Dr. Collins, if I can go back to you. You indicated the problem of underinsured and uninsured, but really uninsured, comes from a combination of rapid rise in healthcare costs, slow growth in family income, and a shift of the burden of costs that leaves the family or the policyholder to pay more for the healthcare costs. And we've heard testimony and opening statements from members saying that premiums have risen 131% in the last decade, more than 3 times that of the average family wage increase. So, Dr. Collins, what kinds of health and care costs are families now being expected to absorb that they weren't 5-10 years ago?
Well, we know from our survey that many more people are paying large shares of their income out of pocket. So whether they're underinsured or insured, have adequate insurance, and that has moved dramatically up the income scale. So about 30% of people who are privately insured are paying more than 10% of their incomes on out-of-pocket costs and premiums. So we're seeing rates that among even middle-income families that we weren't seeing when we did the survey in 2001, for example. So those rates are among middle-income families, median-income families, up where low-income families were in 2001. So it's really spreading up the income scale, this issue.
We've heard testimony today, and our last panel mentioned it, and we've talked about it. I think we all have some idea, but could you explain a little bit more for me about health networks? I know we had the map up there of the states, and most of them only have like 2 or 3 dominant providers. But Ms. Howard talked about health networks. I think Mr. Nall did, and I think Mr. Wilkes did too, about they had to stay within their network. What does that mean from an insurance perspective? Could you explain that?
What it means is, and it's also related to what you're responsible for paying out of pocket. So if your provider is in network, you're likely to face lower costs. You're likely your costs will be lower than there will be if you go out of network. Now, what happens when you go out of network? You may understand that your insurance company pays a certain percentage of your costs. But not knowing, as that policy that was on the screen showed, not really knowing what the cost is. So just not going out of network because your insurance company doesn't cover out of network costs, and being left with a big bill because of that. This map really shows the massive concentration in the insurance industry right now. And it's really has had a cost increasing pressure on overall healthcare cost growth, certainly on premiums. There just is a lack of competition in those markets.
So like my state of Michigan there, Blue Cross Blue Shield is our biggest carrier. So if I go outside of Blue Cross Blue Shield, that I have higher out-of-pocket, or I may have to pay the whole amount because I'm not in the Blue Cross Blue Shield network?
Right. So they will have some providers that are contracting with you that are in network. If you're out of network, depending on your policy, your costs will be covered at some percent of the total cost. But what's hard to know is even if they say they'll cover this percent, it's hard to know what the total cost will be. And so often they'll cover the share, but you won't know what your margin of responsibility is until you get your bill.
Sure, and I live on a border community in the Upper Peninsula, and most of my medical care, in fact, we only have one doctor in our community, is in Wisconsin, so I'm always out of network just about. So therefore, I pay more out of pocket with my policy. And for a record, I don't have the Federal Employees Health Benefit Package. I should, but it's a promise I made. I wouldn't take it until everybody had health care, so I don't have it. So I'm doing myself probably a disservice. But these are decisions that families are doing every day, and if you live on a border like I do, it can be a lot different and greater. So the network is being within there. And so if you only have 2 of your large providers, if you're not one of those 2, and they're probably not offering you a good plan, and you're out of network, it's going to cost you more money.
Probably, yes.
Let me ask you one more question. And you mentioned it in your testimony, but you learn about the types of treatments or medical care that underinsured individuals forego for financial reasons. And some of the other panels, like Mr. Wilkes, he didn't take his son when he thought maybe he should because the costs could be as much as $10,000. And I think your survey was showing the same thing. People were not filling a prescription, not seeing a specialist, skipping. Is that pretty common?
It's very common among people who are either uninsured or underinsured. The striking thing about our survey findings is that people who are underinsured have rates of avoiding necessary care because of the cost at rates that are nearly as high as people who are without insurance coverage altogether. So it is a very real problem. We see it in our data, and it's a problem that has increased over time.
Did your organization been able to develop any data which would show if I'm skipping my doctor's appointment or not getting the screening test, how much that's costing us in healthcare? Have you been able to put a financial value on these underinsured who are skipping payments, premiums, not payments, excuse me, doctor's offices, doctor visits, treatment specialists? Can you put a value on that?
You know, we asked people about their chronic health conditions, and then we asked that group of people in our survey who had a chronic health condition like heart disease, diabetes, asthma, whether they had ever skipped a prescription drug, tried to cut their pills in half in order to make their prescriptions last longer. And about 46% of people who had a chronic disease who were underinsured said yes to that question. Again, those are rates that are really high, almost as high as people who are uninsured. And then we also asked this group whether they'd stayed overnight in a hospital or gone to an emergency room because of their health condition. And we find that about 32% of underinsured patients said yes to that question. So you can expect that people are skimping on their prescription drugs. They're probably having more serious health conditions, and there's a substantial amount of research in the literature that also underscores this finding.
Well, we have the chart up there, and it's pretty interesting. Did not fill a prescription, did not see a specialist. Whether the highest bars there are the underinsured or not insured, or not insured for part of time in the past year, those numbers. I'm sure, Mr. Brock, you see the same thing, because then they must turn to you for trying to get some care, especially since you said in a basic plan, health plan, dental and optical are probably not included, but you even see people who need basic coverage there coming to you who have some sort of insurance. Is that true?
Yes, in fact, large numbers of them are coming now that have insurance, but it doesn't cover those two specific areas. We're getting people now that are coming hundreds and hundreds of miles, buying an airline ticket to come from Florida all the way up to Tennessee. We've had a request from a non-governmental organization in Massachusetts wanting to bus people down from one of the richest states in the country to one of the poorest, to Tennessee, so that we could fix their teeth and make them eyeglasses. So this is becoming even more common, even though we're really not seeing any more patients in many areas than we've been seeing in the last 20-odd years. They're coming from a lot further away.
Well, all the great work your organization does, and you have some of your staff here with you today, and